When you have a stroke, your brain isn't getting the blood it needs. So the sooner you get help, the better your chance of recovery. Dr. Ivan Lopez is the medical director of renowned Institute for Neurosciences. Thank you for your time. We like having you here. We appreciate it. First of all, what is a stroke?
Stroke means that there is a piece of the brain that has died because of lack of blood flow.
And what are the most common symptoms that we should all be looking out for with our loved ones?
More than 80% of patients with strokes present with either speech impairment, facial weakness, or arm and leg weakness. And it's very important to know that the weakness is not over the whole body, but one side or the other. It's not the whole body. If I weak on my legs, that's probably not a stroke. But if I weak on one side of my body, then that could be a stroke.
Okay. And if you are in the same room with someone who is experiencing those symptoms or someone who had a stroke, what should you do first?
You should panic.
Yeah.
And you should call 911. Okay. It is very important that our viewers understand that taking the patient by themselves to the ED is a mistake.
Because it delays treatment?
It delays treatment. So it's best to call 911 and have the ambulance communicate with the ED, and so that we will be ready by the time the patient arrives to the emergency room.
And you hear some people giving their loved one an aspirin. Bad idea.
That's a bad idea because some strokes are the hemorrhagic type. That means that there is bleeding in the brain, and giving the patient an aspirin could make things worse.
Okay. So what can we do to prevent stroke?
This is very important because the best treatment for stroke is not to have one. So prevention. And most of the times, prevention by ways of lifestyle is what is important. So if you smoke, you should quit smoking. If you're obese, you should lose weight. If you don't exercise, you should exercise. Eat healthy. If you happen to have high blood pressure and diabetes, treat those.
Get it under
if
control.
Your cholesterol is high, then treat that.
Okay. So just live as healthy a lifestyle as possible.
That's right.
All right. Dr. Lopez, thank you so much. He will be here until 6 o'clock tonight if you have more questions. Call 858-2222.